Yeah, Madam President, we still have about 100 people who are, we've granted permissions to enter who haven't been able to make it in to the meeting yet. So it should be, that number is quickly dwindling now. We have 1,000-person capacity for this room for Zoom purposes, and we are going to hit it here very shortly. Okay, I think that we've got room for 5 more people, so I think that we are at our capacity. And if you wanted to get started, Madam President.
I will do that.
This meeting is being recorded.
It is approximately 4 minutes after 4 on August 30th, 2021. This is a special session of the State Board of Public Health, and it's being held virtually through Zoom. Thanks to Zoom, this is most likely the largest meeting that we have ever held. To consider, this meeting is to consider emergency rules requiring licensed healthcare facilities to mandate their personnel, including employees, direct contractors, and support staff who interact with individuals seeking medical care, receive the COVID-19 vaccine. This matter will appear before the board for a permanent rulemaking on Thursday, October 21st. I'd like to thank all the board members for attending today. This is a special meeting and we're asking a lot of your time, and I appreciate that. Due to the large number of participants, 1,000 I believe, everyone has been muted and videos have been turned off for individuals who are not presenting. The chat feature has also been disabled. I'd like to begin with a review of the logistics for this rulemaking hearing. Written testimony. The board received written testimony, and all timely written such material is on the board's webpage and is part of the rulemaking record. Hearing testimony during the hearing. After I open the rulemaking hearing, the division will have an opportunity to present the proposed rule and respond to board member questions. I'd like to ask the division to limit their presentation to 20 minutes. The board will then take oral testimony from those that indicate they wish to testify. You will indicate that you wish to provide testimony by using the raised hand feature in Zoom on the lower right under reactions. Testimony will be limited to 3 minutes per person in an effort to hear from as many individuals as possible. Please begin your testimony by stating your name and the organization that you represent. To ensure that we hear a variety of viewpoints on all the topics, we will not take testimony in the order that hands are raised. Board members may ask questions, and additional time will be allotted for an individual to respond. At roughly 6 p.m., oral testimony will end, and the division will have the opportunity to respond to such oral testimony and any additional board questions. The hearing will then be closed and the board will begin deliberations. I want to highlight the importance of not repeating testimony. If the points you wish to make have been stated, please state your agreement or your disagreement with those points. This helps us hear from as many witnesses as possible. Any board member that wants to discontinue the testimony at any time for being repetitive may interrupt the testimony and ask if the testimony be discontinued. I hereby open the rulemaking hearing for 6 CCR 1011-1, Chapter 2, General License Standards. Elizabeth, would you, Ms. Tenney, would you please do a roll call of board members?
No. You're muted. Or you can talk. Okay, can you hear me?
Yes.
Okay, Reyes Dacio,
Here.
Evelyn Barreo,
Here.
Patricia Hammond,
Here.
Kendall Alexander,
Here.
Sean Turk,
Here.
Tom Butts,
Here.
Daniel Pastula,
Here.
that's it.
Thank you, Ms. Tenney. Do any board members have a conflict of interest related to this rulemaking hearing or a disclosure?
President Hammond, just disclosure, I've been helping the state on COVID-19 outbreak response, but I have not been involved in any way with planning, drafting, or discussion of these proposed rules.
Thank you for your disclosure, Dr. Bastour. With that, I would ask the staff to identify themselves and their division for the record and proceed with their presentation.
Thank you very much, Madam President. It is our pleasure to be here this afternoon. My name is Randy Kirkendall. I am the Director of the Health Facilities and Emergency Medical Services Division here at the Colorado Department of Public Health. I also have with me several of my staff, but two that will be helping with some of the testimony or questions. Predominantly, Ann, would you go ahead and introduce yourself?
Yes, thank you, Randy. Good afternoon, Madam President and board members. My name is Ann Strawbridge, and I am the Policy and Regulation Services Advisor for the Health Facilities and Emergency Medical Services Division.
Thank you, Ann. Elaine, would you please introduce yourself?
Yes. Good afternoon, Madam President and board members. My name is Elaine McManus. I'm the Deputy Division Director with Health Facilities and Emergency Medical Services Division at the department.
Thank you very much. And we have a number of our other subject matter experts here in the room with us, should questions arise for them as well. First of all, we appreciate the opportunity to bring before you this emergency rule. As we are all, I think, aware at the request of the governor and numerous individuals throughout the healthcare community, this rule, we were tasked with putting this emergency rule together for 6 CCR 1011-1, Chapter 2. This is an emergency rule, and I think it's important for me to, first of all, I'd like to just simply set a little bit of framework. This rule will be in place. This is normally a 120-day rule. Emergency rules don't stand for a long time, and I think people in the audience need to appreciate that. This rule, should it be passed, will go into effect, but before, as President Hammond already mentioned, a permanent rule will be built and put before the Board of Health at their October meeting. And I think anyone who knows our division and has worked with us before understand that we pride ourselves on a fairly robust stakeholder input process. Unfortunately, emergency rules don't allow us to do that, but we will be coming back to have a second bite at this apple, if you will, with a more permanent rule. And I think as I couch that, when I use the word permanent, I don't think too many things are permanent these days in terms of the pandemic and the work that we are all doing to combat that. Permanency only means until the next change happens along the way. So I think it's important for us to understand that this rule is most likely, for at least the foreseeable future, going to be a living type of rule that may change because we see the disease has already made some changes, and we're going to work hard to keep up with that in a variety of different ways. So please understand this will not in and of itself be the final forever rule. This will be simply a step in the process to protect vulnerable Coloradans. We have received a few letters that I wanted to mention to the board's attention in support of the rule that did not make the deadline And I believe some, if not all, these organizations are here today as well. The Colorado Healthcare Association, which represents a number of the nursing homes and assisted livings across the state of Colorado. The Colorado Gerontological Society has submitted a letter this afternoon of support, as well as the American Academy of Pediatrics, Colorado chapter, has submitted a letter of support. And the Colorado Hospital Association, and finally, last but not least, AARP has submitted a letter of support that is not in the packet, but I wanted to make sure that that was brought to the board's attention. As I said, this is an emergency rule, and I'm sure we're going to learn a lot as we work our way through that. We're going to talk a little bit. I'll mention a few of the high points here, but and then I will ask Ann, who was our primary author on this, to add any color to that might be necessary, and then we'll certainly stand for questions from the board. I suspect that a lot of the questions are going to come over time, and that will certainly help with everyone's understanding as we move forward. It is really, really, really important for everyone to understand that these rules apply to the approximately 3,800 licensed and certified healthcare facilities in the state of Colorado. The Health Facilities and Emergency Medical Services Division, for the purposes of our health facility oversight responsibility, focuses on facilities, not the individuals that work in them. And it has come to my attention that there have been some conversations that clearly were, I think, some misunderstandings probably, that this mandate for healthcare workers in licensed healthcare facilities to be either receive a waiver or to be vaccinated applies to the facilities. It does not, and let me reemphasize that, it does not apply to individual practitioners. It does not apply to me as a bedside practitioner, as a paramedic. It does not apply to my wife as an RN, as individual practitioners. Our authority is limited to those 3,800 or so healthcare facilities that are licensed and certified across the state of Colorado. So I want to be very, very clear up front that this is what this only applies to. This is a rule that would, if passed, will require healthcare facilities to develop policies to assure that everyone who has a patient-facing position or opportunity to work with patients, residents, or clients is either vaccinated, or if they have a waiver, what steps that facility is going to take to ensure and mitigate the spread of COVID-19 moving forward. So I think there has been some misunderstanding out across the community that we've heard today. This is not about individual nurses, physicians, CNAs, or any other healthcare professional. These are simply the facilities that we regulate here at CDPHE. Some of the highlights of the rule that, as you read through it, the rule does indeed contain an opportunity for waivers. Specifically, the rule speaks out to medical waivers, individuals that cannot take receive the COVID vaccine because of medical reasons, as well as religious waivers. For the purposes of definition, the rule does not define religious waivers, but we'll leave it to the facilities to design and develop that and live to it in their policies moving forward. These are policies that will be put together and made available to the department for inspection as needed. And I think it's important to note that for the past 18 plus months, our division has worked very, very closely with all of the facilities across the state of Colorado to develop a variety of mitigation plans, a variety of quarantine plans. This is another piece of that plan. This would be a policy that would go in, and that plan can be designed by the facility for the facility. But they will have to have that plan in place. So those opportunities for waivers are there. I think it's also important for me to note that in normal operations, our division The department has the authority to grant waivers to the vast majority, if not all, of our facility rules on an as needed and as justified basis. So as we move forward into this unknown environment that I think we're all learning something new every single day about, we do have opportunities to make adjustments and react relatively quickly, if not super quickly, to unforeseen circumstances that may or may not occur. There are a number of public orders already out there that we have published through the long-term care task force on how to build these types of policies and how to build these types of plans, and the department stands ready, willing and able to provide that sort of technical assistance and support to any and all of our facilities. This rule is very similar. It's similar in design to the flu rule that presently exists, that has been in place since about 2011. Many people may not appreciate the fact or recall the fact that since 2011 or so, there is a rule that requires facilities to have a percentage. The goal is 90% of their staff who have patient contact to receive the flu shot. Those who don't, to wear a mask during flu season. This is very similar, so this isn't really totally uncharted territory for us in a variety of ways over time. And then I've already made the comment, and I will make it yet again and again. This is not the final rule. This is probably nowhere near the final rule, because we're going to learn a whole lot as we continue to move forward. The past year and a half has been exhausting for all of us in healthcare. We've already seen a number of changes, and we're going to continue to see more moving forward. And the department will certainly stand ready, willing, and able to make adjustments to rules that need to be made to ensure that we continue to have sufficient health care, access to health care across the state of Colorado. So with that said, Ann Strawbridge, I'm going to ask Ann if she would like to call out a couple of other highlights, and then we'll be more than happy to stand for questions.
Yeah, thank you again, Randy, and thank you, board members, for hearing this today. We appreciate everyone's extra time. As Randy mentioned, I think that the key importance here is understanding who this regulation covers. Specifically, that is our healthcare facilities. That is who the department statutorily has the oversight and authority to impose and write regulations for, and that is who is impacted by these regulations. The facilities will ultimately have to ensure compliance among their employees at that 100%. And we do that through policies and procedures in this regulation. That's a very common structure that we use in our regulations already, that we are not in the business of telling facilities how to do their business. They do that through their policies and procedures, which then we ensure are up to date with current guidance and national standards that may exist. So we are handling this much in the same way we handle many other regulations that we see in our health facilities chapters. Again, as Randy mentioned, we do have both medical exemptions are accounted for in this regulation, as well as a religious exemption. I think to underscore, the department is not defining what a religious exemption is or what may qualify as a religious exemption is. That will be covered in each facility's policy, and facilities will be encouraged to look to guidance from the EEOC, their own legal counsel and their own legal counsel on how to formulate such a policy. And certainly we can make reputable resources available as we become aware of them to assist with that. And I think that the other piece that may be on a lot of folks' mind is there is reference to the waiver process included in this regulation, specifically for those for religious exemption purposes. One, I would like to point out that this is the same waiver process the department currently uses for all regulatory waivers, and has been in existence for quite a while, and is a system that we know how to operate quite well. The intent there is that the department will be looking at examining the adequacy of those mitigation plans to ensure that the measures proposed by the facility are enough to protect vaccinated or unvaccinated individuals from exposure, or, and we want to protect the patients. We also want to protect staff, right? And so we're just looking at what is the adequacy of those mitigation measures in that plan, not is the facility's plan defining religious exemptions adequate or not. So the department is not granting individual medical or religious exemptions. That will be done at a facility basis. The department would be granting a waiver from the 100% compliance rate. And I know that that's very kind of splitting hairs, but there is a nuance there that is important. Otherwise, I think that those are the high points right now, but certainly happy to answer questions if the board has those at this point.
Thank you very much, Ann. Elaine, I forgot to mention, did you have anything to add?
No, I appreciate it, Randy. I'll stand by for questions. Thank you.
So, Madam President, any questions from the board will be more than happy to answer.
Thank you for your excellent presentation. Do any board members have questions? Dr. Pastula.
Question. So it sounds like the religious exemptions are very broad. I want to ask about the medical exemption, exactly how that works and defined in the language, and what would cover that. Could you explain a little bit more about the specifics there?
Sure, I'm happy to take that question. So we don't actually necessarily define what medical exemption is. You'll see on, let me just scroll down so that I'm looking right at it. What we do have is one that at 12.2.3b, the facility will need to define their criteria for accepting or rejecting medical or religious exemptions. So there is some facility input there. But we also use the same language at 12.2.4, which is currently in our flu rule, to speak to what the documentation of a medical exemption would look like. So that is signed by a physician, physician assistant, advanced practice nurse, or certified nurse midwife, stating that the vaccine would be medically contraindicated for that individual. So that is as close as we get to defining what an appropriate medical exemption would be for purposes of this. So it would need to be issued by an authorized practitioner and also fall in line with the facility's policy on what they would accept for a medical exemption.
Thank you, Ms. Strawbridge. Dr. Pastula?
Oh, sorry, follow-up question. For that, would, because I know they have the official like absolute contraindications to the FDA, but then they have some precautions around certain areas in CDC, ACIP. Would those be covered under this if a physician, nurse, advanced practice person, midwife, nurse practitioner does that? Would that be covered under this language?
So I'll speak to that. It's really left up to the medical professional between them and the individual employee, and the medical professional makes those determinations, and that's how broadly we wrote it.
Thank you.
Mm-hmm.
Any other board members with a question? Mr. Butts.
Thank you. I think Mr. Turk has a question as well. And this may be a little in the weeds, and I apologize. I think you were clear that regulation applies to facilities, not to individuals. I think the one group that as I read through the comments, struck me as a challenging kind of situation, and help me unpack it, is those that are in-home providers for family members. And could you address whether they're through their employer part of this, or are they exempted, or if so, how would that happen to address that group?
I will also let Elaine jump in here as well, because this is certainly in her wheelhouse. But there are instances where an individual, whether that be a parent or another caregiver, becomes an employee of a licensed home care agency in order to receive reimbursement for providing care to their loved one or family member. In that instance, if that individual is an employee of the home care agency, or say is a one-person home care agency themselves, then yes, they would be subject to the regulations as they are currently written.
Yeah, I don't really have anything to add. I know we've had some questions in regard to that, and many of the relative care providers work for, as an employee, Medicaid certified facilities. But yes, as an employee, they would be expected to follow the same requirements.
Thank you, Ms. McManus. Mr. Turk.
Thank you, President Hammond. Just a couple questions for clarification on my end. So first question, can you explain why we went with a religious exemption as opposed to a personal exemption, similar to school vaccines and some of our other rules?
Yeah, I think that for purposes of keeping these very different requirements distinct and different, you are correct that the school vaccine regulations do use different verbiage. They have what is known as a non-medical exemption, which covers both religious and personal belief. In looking at the settings that we are dealing with, which are high-risk healthcare settings with high potential for exposure to at-risk individuals, as well as our existing flu regulations, which only account for a medical exemption, we wanted to give some latitude, understanding that there is certainly there is some concern on religious belief, but also wanting to maintain that this is different and is a different expectation for healthcare facilities than for school vaccination, and to ensure that we were providing a high level of protection in those facilities.
Okay, thank you. And then, again, this is more clarification and partly for folks that may be listening in. So this applies to facilities, not individuals. So if, for example, an individual licensed practitioner that is not in one of these facilities chose not to get a vaccine, they are not losing their registration. We're not DORA. This is not going to impact their licensing, correct?
You are correct.
Okay.
Absolutely correct, Sean. Thank you.
Yeah. And then the last question or clarification in regards to the waiver request. So, and you mentioned you'll just be reviewing essentially a waiver to not meet that 100%. You will not see, for example, the list of employees that have requested a religious exemption or a medical exemption. That is not part of the process.
Correct.
That's
yeah.
correct.
Perfect. Thank you. That's all I had. President Hammond, thank you.
Thank you, Mr. Turk. Let's see, did I see someone else with their hand up? I can't see everybody at once. So
that was me. It was right, but Sean asked the same questions I was going to ask. So thank you, Sean.
And if you'd be so kind, Mr. Cadill, could you reinforce the concept that this has nothing to do with licensure for licensed medical care people?
Absolutely, Madam President, I'd be more than happy to. Again, just to reiterate, our authority under this part of the law is strictly around the oversight of licensing and certification of healthcare facilities. There are about 17, I believe, 17 different facility types that we oversee. Everything from hospitals to nursing homes to assisted livings, renal dialysis centers, ambulatory surgical centers, and a variety of IDD programs of that nature. So this rule will only apply to those facilities of which we have authority to either license or certify on behalf of Healthcare Policy and Financing or the Centers for Medicare and Medicaid Services. And I think it's important to bring out here our nursing homes across the state of Colorado about 230-ish of those facilities across the state. The Centers for Medicare and Medicaid Services has already made it very, very clear that a vaccine mandate will be required of federally certified nursing homes. Keeping in mind that over 40% of the deaths that we've experienced here in Colorado have occurred in residential care settings of this nature. So it's important to also remember that regardless where this rule is concerned, our nursing facilities are going to be requiring it. And we have an obligation here in Colorado, and we've worked very, very hard to make sure that our licensing regulations over facilities are as consistent and harmonious as possible with the federal code for our certified facilities across the state of Colorado. So again, this is all just facilities about their policies. How they choose to deal with it is between them and their employees, no different than the flu rule that's been around for a while. And so it does not, I'll repeat it one more time, does not have any impact on any individually licensed or certified healthcare provider in the state of Colorado.
Thank you very much for that. Dr. Vistula.
Thanks, President Hammond. I had a follow-up question. So for those people who have a formal religious or medical exemption, I think I read in there in 12.2.3 that each facility is supposed to have a plan for either surveillance, testing, or other things to kind of increase the protection. Could you talk a little bit about that for the people who receive a formal medical or religious exemption here?
So I'll take on a little bit. First of all, Dr. Brewer, I think we all understand and appreciate this is new territory, but waivers that will be required to the 100% requirement as the rule is currently written will need to be applied for to the department. One of the things we will ask at the division when we get that application, and we do this with waivers constantly across the board because there are a variety of instances on a routine basis where waivers to nursing coverage in rural communities, for example, or building code issues that have been met in another way, we grant waivers to. One of the things that we will add to our response to that waiver is the facility needs to demonstrate to us how they will combat the spread of the disease within their building by those individuals who are not vaccinated, whether that be masking, whether that be constant testing, which is in place today for all of our healthcare facilities in terms of testing opportunities that are there. So we will be providing that guidance back to those facilities to ensure as safe an environment as we possibly can for Colorado's most vulnerable citizens.
Thank you.
Any other board questions?
President Hammond.
Yes, Mr. Alexander.
Randy, I'm trying to formulate this question, so bear with me. And just a reminder, I do represent behavioral health as one of my constituents. And I recognize that there are a large number of behavioral health entities within Colorado who are not considered to be a licensed healthcare facility. And it's my understanding that obviously this rule, I'm assuming, does not apply to behavioral health entities who are not considered a licensed or certified healthcare facility.
That is correct. Absolutely. There are a relatively small number of those types of facilities that are actually licensed where this rule will apply. So if you're not licensed or federally or state certified under our authority, this rule does not apply to you at all.
Thank you very much.
Any other board questions? Mr. Butts.
Thank you, President Hammond. One quick question. So as drafted, this requires biweekly reporting of status of facilities. Does that include if there were no changes to occur in that 2-week period, they'd still have to report, just same as last time?
Yeah, thank you very much for the question. I very much appreciate it. That was another point that I failed to make thus far. So the twice a month reporting requirement is in this emergency rule. As you heard me say earlier, we know that there are things that are going to need to be changed, that we're going to learn with this emergency rule, that we're going to incorporate into the next iteration. I don't want to say the final rule, but the next iteration of the rule that we'll bring before you in October. And we understand very clearly that this pandemic, with we've all got our fingers crossed this thing is going to eventually subside and become less of and no longer the emergency that it is today. So reporting requirements will change. We understand very clearly that that is a burden on facilities, and twice a week reporting is not a sustainable alternative in the long run. Our thought is that we're going to learn a lot initially over the time of this emergency rule about the numbers and where the facilities are out there. We will continue to learn as we get further into the year. And as those requirements for reporting need to be relaxed, we will be back relaxing those. And so, our division's before this board a lot, and we're going to be back with this rule over time because we consider it a living, breathing document right now. Because we are all working so hard at trying to keep up with which way things are turning for us in terms of the pandemic. And I know that we're all frustrated with it, and we're going to do the very, very best we can to support our facilities out there to keep folks safe. And so when we can back off on that, we will. Absolutely.
Okay. Yeah, thank you. It seems like an element that could be right-sized once you have a little track record and understanding of what those look like.
Absolutely. Thank you.
Ms. McManus, did you want to add to that?
Well, yeah, I was just going to add that in the current reporting, it's the way that system is set up, the providers put in numbers and they change those numbers, should they change, when they go back in to put the information in. So I would imagine the system would be set up very similar to where they can skip past those things that haven't changed and just modify the things that have. So I think we've strived to be less impactful for the facilities, and certainly if nothing changes, they can just skip past all of those pieces of information that we're asking for.
Thank you.
Thank you for that clarification. That does help.
Dr. Stasio, did you have a question?
Yeah, Elaine just answered it.
Okay.
That's great.
All righty. Any other board questions? Mr. Alexander.
Clarification. One of the concerns that have been raised, at least with folks that I've met with and spoken to, is the logistics of meeting the vaccination deadline schedule as presented, considering the need for several weeks between vaccinations. And I wonder if Randy could maybe speak to that issue.
Thank you very much. I do appreciate it's a very good question. The deadlines that are in the rule at this moment in time are the deadlines that I believe Governor Polis mentioned in his letter to the board, requesting that the board undertake this, considering this rule. And so that's where they came from. Now, with that said, I'll reiterate again, the good news is the division has waiver authority over virtually any rule that's in any of our facility chapters when that is appropriate. And we have a mechanism to consider those and weigh those. And so I would suggest to you that if there's a facility that it's a matter of timing or having to wait an extra week, we're certainly going to work with facilities to do that. And we will ensure that we are not agnostic to the notion that people's lives are people's lives, and we need healthcare providers out there. Our biggest fear is we know that this is putting pressure on an already overly stressed healthcare workforce. And so we're not going to do anything, we're going to do everything in our power not to overly stress that, assuming we can maintain the appropriate levels of safety for the patients, clients, that are in these facilities. So we'll work with them, absolutely. Those deadlines are there simply because at this moment in time, that is what the governor asked for.
Any other board questions? I'm having trouble seeing the whole board on this screen. We have so many participants. Okay, I think if I don't see any more questions from board members, we will move on to oral testimony. If you're interested in speaking, please use the raise hand function. It's down at the bottom of your screen under reactions. When you're recognized by the board, you will be unmuted. Remember, you will be limited to 3 minutes. Because of the number of people indicating they wish to speak, please be mindful of being repetitive. And testimony will end at 6 p.m. Elizabeth, would you please unmute the first person? And please remember to state your name and the organization you represent for the record. And please thank you all very much to the public for being here. It means a lot to us that we get such really terrific, enthusiastic response from the public. So thank you all for taking the time to be here. Elizabeth?
Hi. So first of all, just to repeat what Patricia said, please use the raise hand function in the bottom of the screen in the reactions tab, or if you're on the phone, you can press *9 to raise your hand on the phone. I'm just going to go on the list. So the first one I see is Larissa Argare, so I'm going to unmute you.
Beautiful. Thank you so much. I'm going to walk away. I'm here at a protest, as you can hear, in front of your building right now. We've had about 200 people, and this will be on the news. Thank you guys for having this meeting today. Hopefully you can hear me. Again, I'm virtually, on my phone with a lot of people. So I'm here today to urge you to vote no to this mandate that will strip healthcare facilities and workers of their right to choose what goes into their bodies. This proposal has zero scientific backing. We know without a doubt that this vaccine does not stop transmission of SARS-CoV-2. Its use is indicated by manufacturers and is proven through data gathered during this pandemic is to attenuate the effect of the virus in an infected individual. Mandating a vaccine that is not intended to stop transmission or infection is just plain bad science. What precedent are we setting here? And I'm sorry if I didn't say at the beginning, but I'm a registered nurse. I work at a large healthcare facility. Many of us in healthcare, myself included, have worked through the entirety of the pandemic, holding hands of sick patients. And many of us have already acquired natural immunity. Why is natural immunity being left completely out of the equation? A recently published study shows that individuals with natural immunity have 13 times greater protection against the Delta variant than vaccinated individuals. If our healthcare department wants to create rules and regulations in the name of health, may I suggest with the obvious? Obesity, diabetes, hypertension, and other metabolic conditions have been demonstrated as a crucial contributor to the enhanced morbidity and mortality of patients with COVID. Clearly, our population is not vaccine deficient, but health deficient. Further, who will be held liable for those of us who have adverse reactions to this forced injection? As it stands now, VAERS, I checked today, has hundreds of thousands of reported injuries and over 13,000 deaths. Are we no longer following that data? I personally and professionally know numerous individuals who have had a reaction to the COVID vaccine, including strokes and death. Again, I'm a nurse, so I'm seeing this. I'm not speaking out of left field. Vaccine manufacturers have absolved themselves of all liability when it comes to untoward reactions to the vaccines, making it all but impossible to get reimbursed should you get injured due to the vaccine. Will Colorado taxpayers be on the hook for these bills? Or do you suggest individuals start GoFundMe campaigns, as I know many are being forced to do? Where will these mandates end? How many injections will be forced? 5, 10, 20? We have no long-term data on this vaccine, and we have yet to complete phase 3 of the trials. FDA approval literally means nothing. We know this is a captured agency working for pharmaceutical companies. Their track records include unleashing an opioid epidemic on society and being charged with some of the largest criminal fines in history for fraud and lying about the safety of their products. And now we're being asked to inject their products into us under threat of losing our jobs. Tell me, if my job can compel me to take a drug under duress or lose my job, what else can I be forced to do? On behalf of all healthcare workers, we demand better. We implore you to hold our medical freedoms as tantamount and vote no for vaccine mandates.
Thank you. Okay, next person I have is
It says Representative Rich, and I can't see the rest of it, but I'm just gonna unmute you and you can introduce yourself.
Thank you very much. My name is Representative Richard Holtorf. I represent Southeast and Eastern Colorado, 9 counties, bordering Kansas, Oklahoma, and New Mexico. In the last 10 days, I've had 15 or 20 of constituents and also healthcare facilities that have contacted me. And I just wanted to share some comments with the board. The rural-urban divide is real, and one size doesn't fit all. Rules certainly don't apply. And I know that you have talked about the rule proposals, and there are many opportunities with exemptions and also some variances. What I'd like to let the board know is in rural Colorado, we have already a shortfall of 10 to 30% in our facilities of medical staff, just because of the nature of rural Colorado and the nature of the availability of medical professionals. There's also concerns that if we have a very rigid rulemaking and it's top heavy, that an estimated 10 to 20% of the medical staff and personnel that are working will not want to comply if they're not giving their exemptions or variances. And many of them said, and particularly where I represent, it's very easy for people to drive into Kansas and work at a facility in Kansas or Oklahoma or New Mexico for some of the communities that I represent. So we have a very large concern with how this rule will be applied and what the impact would be for rural Colorado. So the one thing that I'm asking for the board to consider is a manpower variance or some type of metric or system that will allow these medical facilities that are in my district to have some type of opt-out or waiver or variance so they can keep their staffing at the highest level. And if those personnel do not want to vaccinate, then they have the absolute highest level of PPE and the most rigid criteria for providing safety to their customers, clients, and or patients. I wanted to just, and I'm going to close with this. It's really important that the board understand the needs of rural Colorado and try to develop a system that will help those CEOs, the administrative personnel that are trying to keep my rural hospitals, clinics, nursing homes staffed at the highest level possible, so we don't have a loss of personnel. I'm going to end with that. I thank you for your time.
Thank you. The next person I have is Mary Jones. You should be unmuted.
Hi, this is Mary Jones. I am just an individual that lives in Loveland, Colorado, and I want to reiterate that this is a problem to have this be a mandate for all facilities. One size does not fit all, and as we've heard from Governor Polis, his emergency mandates have been renewed for the past 12 months. So it will not be a short-term thing, and we're not going to have time to manage talking to you again every time you have a new decision-making meeting. And thank you for your time, board, because I know time is of the essence. I'm also a religious person that does not believe in taking medical treatment for anything except for when I was born, because I was required to be in a hospital to be born. And I would continue to do that. And I'm planning to not go to any facility, but I would love to be able to visit people that are in facilities. And that's one thing that's happened that is not very good. Governor Polis having all of us not be able to visit anybody that's in a care facility for any reason, that is torture to those that have dementia that have no idea why they are in a facility or who they are, and they can't even talk face to face with their family. So there's got to be a problem with how it's managed that way. There has to be some compassion there for each individual to know that they matter and to know that they have a choice of how they would like to be cared for. I'm sure, you know, if you have a child that's in a care facility, that child needs to have interaction with adults and needs to have a time to be around, surrounded by his loved ones, and not be just around medical professionals that aren't related. I have a question about, you mentioned that the policies and procedures would dictate how this is managed, and that you have the right to oversee those policies and procedures for each facility. My question is, what is the recourse if they are not compliant? Are you going to fine those facilities or take them out of business? What is your process of handling those disputes when those facilities are not compliant for whatever reason, like the previous speaker said, a rural exemption because of their need for having practitioners in their area of Colorado?
Thank you. Mary, I'm just going to mute you again, lower your hand. Okay, so can we have, the next person is David Brumbaugh.
Thank you. My name is David Brumbaugh. I am a physician and the chief medical officer at Children's Hospital Colorado. I'm speaking to you and appreciate the time from the board on behalf of our hospital in strong support for this proposed rule for several reasons. This is the right thing to do for patients. Our patients and families deserve a safe environment when they come into any one of our healthcare facilities. And I'd remind the board that when we're speaking specifically of children, over 75% of our patients are currently ineligible for receiving vaccine and don't have the ability to protect themselves. This also protects our healthcare workforce. We know and have solid evidence that these vaccinations protect against severe illness and hospitalization. And more than ever, we need our doctors and nurses to be on the front lines caring for patients. We have staffing shortages in our clinical workforce across hospitals and healthcare facilities. And now is the time we need to make sure that they are available and not sick with COVID. Finally, if we use influenza as a benchmark for rulemaking, the COVID vaccinations are superior to influenza vaccine by any measure of effectiveness and safety, and protect against a more severe clinical disease than flu, which is COVID-19. So thanks for the board's time. Children's Hospital of Colorado strongly supports this measure.
Okay, thank you. And so then the next person I have in mind is Anthony Lieberman. Sorry about that. You should be unmuted.
Good afternoon. Thank you, board, for taking the time to have this meeting and allow me to participate. As the woman said earlier, my name is Anthony Lieberman, and I'm a member of the public. So I am not too keen on having this mandate, and let me explain why. As I see it, the dilemma that's before you, and I understand that it's Governor Polis who asked you to do this, and it wasn't of your own accord, but only by the means of the governor requesting it to be so, that you had to come up with this mandate, so to speak. So to me, I see a multifaceted folded problem, which is, one, you're circumventing the end individual's Ninth Amendment rights by mandating it on a facility and passing the liability from the government to the facility. And for those of you not familiar with the Ninth Amendment right, it's that right that, you know, currently abortion exists on, which is my body, my choice, in a truncated fashion. I don't need to go into detail with you here on this. And then the second one you're violating is HIPAA. The HIPAA rule clearly states, you know, it's my health information is private, it's my own. And to have a mandate that force the facility to violate that of the individual, I personally think it's just wrong. Thirdly, as a member of the public, I'm trying to understand why is it that we think that healthcare providers and all of their aspects in these facilities are so ignorant that they don't know the risk that's involved to take or not take a vaccine. Now, clearly in healthcare facilities, 30% of workers are not vaccinated, 27% are not vaccinated. In nursing homes, per your own data that was in the mandate that you have drafted. And I'm just trying to understand, why is it that we feel, or you feel, better yet said, that we should make them do something that they're clearly intelligent enough to make that decision for themselves? We're not dealing with people with low IQs or who work at a factory turning a bolt and don't know better for themselves. They're very intelligent individuals in all of these facilities, and they must be to have these jobs. And so I'm a little bit dumbfounded why we would have this rule to begin with. And finally, I'll close with a handful of other items, which are, vaccinated people are still getting sick, okay? Viral loads in vaccinated people are still 1,000 times greater than those who aren't vaccinated. And I'm going to agree with Marissa's statement earlier, which is natural immunity is not being counted here. And there are plenty of studies out there that show natural immunity is many-fold better than the vaccine, and is also much longer lasting. And that's not in there either. Finally, last but not least, OSHA in mid-April said any employer who says you have to have a vaccine is held liable for any adverse effects that happen. And employers had a conniption fit about this. So if it's safe, why would employers have an issue with it? And I'll close with that. Thank you so much.
Thank you. I'm just going to mute you again. The next person I have on the list is Margaret Righty. You should be unmuted, or it should prompt you.
Thank you. Thank you, Madam President and members of the board. My name is Margaret Reedy. I'm the Chief Medical Officer for UC Health, and I encourage the board to vote yes for this rulemaking. At UC Health, we elected to mandate vaccination for our healthcare workers, some of whom are providers and many of whom are not providers, but work in other areas in our health system. It has gone very well. Currently, we are about 93% vaccinated, and about 4% of our workforce has become compliant with our rule by applying for a medical or a sincerely held religious belief exemption from the requirement. 97% of our providers are vaccinated. I think it's important for us all to remember that most vaccinations don't prevent disease, rather they blunt the seriousness of infectious diseases. And as has been previously mentioned, the vaccines available for COVID-19 are very effective. There is a precedent for requiring healthcare workers to be vaccinated in the influenza vaccine, which most healthcare workers across the state comply with annually. It's important that we all be available to take care of patients. Certainly at my system, we want to be able to support the rural hospitals in taking care of patients in those more remote counties in the state by making sure that our personnel are available. As with children who are unable to be vaccinated, patients who have cancer or transplants or other conditions which cause their immune systems to respond more slowly, they can't protect themselves either. And it is important that we as a healthcare system remember who we're here to care for and the shape those patients are in when they're in our halls. We believe that this is the right thing to do. We have found it to be very manageable inside of our health system, and we strongly encourage the board to vote yes. Thank you for your time today.
Thank you, Margaret. The next person I have is Mary Brewer.
Yes, thank you for hearing me today. So I'm speaking on behalf of some of my peers as well as my staff who have come to me with very strong opinions about not being mandated to take a vaccination that they do not want to receive. So I am encouraging the board to vote no on this. They have made me aware, and I have done a lot of research on it, that it's against our liberty, it's against our freedom, it is against our rights to be forced into doing a vaccination that they don't even know what is in the vaccination. Healthcare workers are saying one thing, and then they're saying another. Dr. McCullough has testified before the Senate on this issue that we don't even know for sure what the result of these vaccinations are going to do to us. I have an employee whose teenage son got the vaccination, and within a day of getting that, he had a heart problem. They're relating that to this vaccination. Further to that, as an employer, what is my liability when one of my staff is mandated to get a vaccination and they either get deathly ill or they die? How does that affect my workers' compensation? How does that affect legal action in the state of Colorado? We are now going to be seeing a lot of people suing employers and suing each other because they have gotten sick from having to be mandated to take a vaccination. I agree 100% with the nurse that was first on, Larissa. I couldn't have said it better. She gave facts of the matter. And as the last gentleman said as well, I mean, we are all intelligent adults. I do not feel that the onus of this thing should be put on a facility, because all that is saying is the facility has to comply, which means they have to force their employees to comply. With this shortage of healthcare workers and other workers now, we can't even hire enough people. We can't find people to come to work. And now we're going to lose people because my staff has told me if they're forced to get this vaccination, they're going to quit. So now what does that do with us serving substance abuse people? We lost more people last year that died of heroin overdoses and alcohol than any COVID incidences in our facility. We had 0 in our facility because of everything that we did here. Now we're going to be mandating our employees to do something that they don't want to do. I am encouraging this board to please vote no on this. We lose our freedom and we lose our rights as Americans.
Thank you, Mary. The next person I have is Jared Despres. Sorry if I mispronounced.
Hey, good evening. It's okay. It happens quite often. My name is Jared Dupre, and I am here on behalf of my wife, who is a registered nurse, and my mother-in-law, who is a registered nurse. My wife had to work this evening and was unable to make it. She also carries a bachelor's in science of nursing, and to get around all the noise of, everybody has their own, what they would say, facts and opinions, which is great. It's a free country and you're allowed to. This is what I do know. My nurse is very well educated. She's been in this field for a very long time, and nurses in general, as many on the board here, I see some of them are nurses. You stick to your convictions, you stick to your gut in making decisions throughout your career. And it's not a career, this is a lifestyle. You choose to help and take care of people. And she feels that being mandated to take something that she currently can't accept at the moment as being scientifically proven is really degrading to her as a medical professional, as someone who has spent so much of her time caring for patients, putting our family's time on hold so that people can stay alive or that families can grieve together with someone who let them pass on from this world. And a nurse is more than just numbers and statistics. A nurse is someone who is there and cares. And it's not just nurses, it's the certified nursing aides, LPN, doctors, of course, but I speak on behalf of my nurse, and my nurse, this is her life. She will not quit. She will be forced to be fired if this is mandated and she is not allowed an exemption. I would just ask, beyond the facts, beyond everybody's opinions, beyond everybody's emotions, that there would be compassion taken into account for the nurses that truly love what they do, who would go to work for no pay if it meant that they were able to care for someone. And that heart of a nurse to be taken into account that if they feel that this isn't the best option right now for them, that maybe they could have a little more leeway. It just seems that all their choices are being taken away right now. And again, I appreciate you guys being so open to this. You guys are being really great. You've answered some very good questions that we have had, and this will not go unnoticed. Really appreciate what you guys are doing. But again, nurses out here in the rural community, they have convictions, and it's what makes them great nurses. And I would ask for a little more thought into those convictions going forward with the vote, and maybe a little more leeway on some exemptions. I'm not political, so I'll just end with that.
Thank you. Next, I have Deanna Powers.
Hi, my name is Deanna. I am the administrator for a little R&R home care out of Larimer County. We are just like every other entity out there struggling with staffing. I'm here with my entire office staff actually, and we are all here to urge you to vote against this. We did our own research actually. We surveyed not only our staff, but staff from 2 other agencies. All staff members were invited to participate and all responses were anonymous. The results were more than concerning for us. We found that around 40% of staff will quit their jobs if this vaccination is required by us, their employer. Around 48% of all participants expressed concern about vaccines being required due to potential job losses and fear they will no longer have a right to choose moving forward. That should concern all of you. At this point, we are not able to lose even 5% of our staff, much less 40%. What is your plan for those who at that point would find themselves unemployed? Not only will our unvaccinated be unemployed, but the vaccinated will also find themselves without jobs as well, as there will not be enough of them to sustain every agency. Most of the individuals we employ have been in home health for years. They have little educational background and few other skills that would allow them to have a competitive wage outside of what they're doing. They will all likely apply for government assistance, which will in turn raise taxes and come out of your pockets. So those of you that still have jobs will be supporting those that you've basically given the boot to. You may say that those vaccinated can go on to work for agencies willing to comply and who can stay open, and that is true, but that doesn't solve our unemployment problem that we will have with the other 40%. What about our patients and clients? Our agency alone cares for approximately 100 clients every month. Some of those may be able to follow their vaccinated care staff to other agencies, but what about those who may not have that option? Roughly 30% of our client base is unable to walk or handle their essential living needs day to day. If they are unable to find care immediately, they will have no choice but to go to a hospital backup unit until care is found. What's the plan to avoid any lapse in care? Hospitals are also facing shortages of their own. Will they be prepared to take on our homebound individuals who will no longer have the option to live in their homes? Because agencies statewide will be shutting down. Are we prepared for possible deaths and potential lawsuits to follow because of the lack of care? People are concerned. People have medical and religious reasons to decline that are important to their livelihood. Can you promise that if I force my 30-year-old caregiver to get vaccinated, she'll still be able to bear children 3 years from now? Can you promise my pediatric clients, if their provider parents get vaccinated, that they will not develop life-altering side effects 1 year from now that will hinder them from being able to continue care? No, you can't, because not enough time has passed to answer those questions and give reassurance to the people. No one should have to choose either or. The last question I'd like to leave you with is this: what if you're wrong? What if there are serious side effects that have not been discovered yet due to a lack of research data? What if you force something potentially harmful onto our essential workforce and we start to see drastic consequences months or years from now? Those allowed to work will be unable to act loud. What if you're wrong?
Thank you, Deanna. Next, I have Deborah Edwards.
Wanted to, say thank you to the lady that just spoke, as well as Jared, Mary, Anthony, and Larissa. They all expressed many things that I wanted to express as well. I am a physical therapist who has been practicing for 28 years here in Colorado. My current facility that I work for, we have been open the entire time and have been treating patients the entire time and have had 0 staff cases and have had 0 patient cases connected to our facility. Patients have gotten COVID, but it has not been because of us. They've contracted at their work or other locations. I also would like to say that I disagree with two of the prior physicians that spoke based on testimony statements given by Dr. Christina Parks, who is a PhD through the University of Michigan in their School of Medicine. Her testimony, which was given before the Michigan House for House Bill HB 4471, with testimony given on August 19th, 2021. She states that with the current vaccine, it does nothing for the Delta variant, and it does not prevent transmission of this disease, including the original COVID-19 or the Delta variant. So it doesn't make sense, the argument that was given for protecting children, because it doesn't prevent transmission. It lessens your experience of COVID-19, but it does not do anything to prevent transmission to another individual. So requiring the vaccination doesn't do anything to protect anyone. And then, as I mentioned with some of the individuals that spoke previously, this is a breach of our amendment rights. As an individual, I don't have a right to say what is put into my body. And as a healthcare provider, I should not be forced to put something in my body that I do not want. And the reality is we don't know enough about this vaccine. It has not been in existence long enough. And if we look at usual practice with the FDA approval system, a typical vaccine takes a minimum of 10 years between idea to development, testing, and then eventually to the approval process. This hasn't even been a year. So it's impossible for us to know all the potential side effects. And there have been some very scary side effects, including death, among people that are otherwise completely healthy. With the reports that are on VIIRS, we're looking at 13,000 deaths. And, a lot of those people were perfectly healthy people. How can we mandate this with these facts?
Madam Chair, this is Evelyn. May I ask that if there is more repetitive testimony that may be shortened? We can, Mr. Madam President.
Madam President, you're muted. Can you unmute yourself?
Thank you, Dr. Barreo, and we'll ask everyone to try not to be repetitive, and we've got lots of people that would like to speak, and that would help us get through it. Thank you.
Okay, so next person I have is Kevin Cadill. You should be unmuted.
Thank you, Madam President and honorable members of the Board of Health. My name is Kevin Cadill. I'm a policy analyst with the Colorado Hospital Association. The association represents more than 100 hospital and health system members statewide. Thank you to the department and the board for the opportunity to provide testimony regarding these rules. Hospitals and health systems in Colorado have been actively engaged in efforts to vaccinate communities, starting with staff and continuing with other frontline workers and the local community population. Science has shown that the vaccines are safe and effective at substantially reducing the risks of becoming infected, spreading the virus to others, and becoming severely ill or dying from the disease. CHA recently joined with 18 other leading healthcare organizations in a joint statement to urge support for steps to stop the spread of COVID-19, including that all healthcare employees should become vaccinated. In regards to the reporting requirements included in these rules, the association urges the department to work with the association and our members to ensure flexibility and alignment with similar federal reporting requirements, especially with such a short time period in which to come into compliance. The continued safety of our healthcare workforce remains a top priority, and COVID-19 vaccines are among the best tools we have to protect staff and patients in healthcare facilities across the state. Vaccination is the primary way We will avoid overwhelming the healthcare system in our state and finally put the pandemic behind us. Thank you for the opportunity to provide comments on this rulemaking.
Thank you, Kevin. Next, I have Emily Adams. You should be able to unmute now. Try again.
Okay, thank you. Thank you so much for taking the time to listen to public comment. I'm sorry because it sounds like people did not listen to your points or what this ruling actually covers. My name is Emily Adams. I represent myself and I am a parent of 2 children. I'm a longtime member of Colorado Immunization Advocates, a group of parents who are pro-vaccine and recognize how important it is that our public health policy is guided by science. I was also lucky enough to participate in the Johnson & Johnson vaccine trials. This January, my 13-year-old daughter spent more than 2 weeks in the hospital over the course of an extremely rare 4-month illness. During that time period, healthcare providers were first able to have the opportunity for vaccination. The existing fear and anxiety of having your child be extremely ill was, for me, compounded by the reality of COVID all around us. I want to know, both for me and for families of other children who need care, should we ever be in a situation where we are in a healthcare facility with a sick child, that at the very least the facility is required to reduce the likelihood of spreading vaccine preventable diseases. My mother is also often in the hospital and uses home health services frequently. I want to know that she is protected by the facility providing employees who give her care. Thanks to science and the diligence of people around the world working hard, we now have safe and effective vaccines available to nearly everyone who would like them in our country. Unfortunately, individual facilities may not have the ability to create the kinds of policies that you are requiring without the backing of a CDPHE rule. The requirement to create policy seems like a minimal bar in our overall public health approaches that should include various layers of mitigation strategies. Just as we as a society create ways to protect our most vulnerable individuals from flu and other vaccine preventable diseases, we should also protect others from COVID. Thank you.
Thank you, Emily. Next person I have is Dr. Kent Roverson.
Thank you to the board for, can you hear me?
Yeah.
Thank you. Thank you to the board for this opportunity. I am a family practice, board certified family practice physician in District 5, Colorado Springs. I've been practicing patient care and clinical medicine in the community since 1997. I have a master's degree prior to becoming a physician that had an emphasis in experimental design. And I've been involved in over 40 pharmaceutical research studies, so I'm familiar with this ground. I, like the last commenter, agree we must follow the science. The science, however, concludes differently than the last caller. And I want to point out a couple fallacies in the emergency rule analysis, specifically analysis number 5, the determination whether there are less costly or less intrusive methods. The analysis did not consider repurposed medication, which as of June of this year, we have a elegantly done metadata analysis published in the American Journal of Therapeutics, showing the moderately strong evidence that ivermectin can be used both in early treatment and prophylaxis. This rule doesn't include a consideration of ivermectin use and therefore is set up on a false duality that it's either mandate shots or voluntary shots. You need a third option. Second, Rule 7, or a rule analysis number 7, I'm not sure if I'm getting the terminology right. The analysis must take into account both short-term and long-term consequences. the stated analysis is insufficient, and we have competing data. The MMWR reported a 2.4 times increase in native immunity compared to those who are fully vaccinated. However, this was a tiny study and was pre-Delta variant predominance. This last week, the important information comes out of Israel, and they found that fully vaccinated individuals with the Pfizer vaccine, and Israel, for context, has somewhere around 70 to 80% of its population immunized. The Israel Ministry of Health showed they have a 6.72 times increase in those who have been vaccinated versus those who have prior immunity. So again, you have a fallacy in the argument for this emergency rule. Thank you for your time.
Thank you. Next person I have is Janet Cornell.
Thank you. Can you hear me?
Yes.
Okay, this is Janet Cornell. I'm an administrator of an assisted living, or of 3 assisted group homes. We take care of 7 people per home. And I'm also a board member of the Colorado Association for Assisted Living Facilities. I'm asking the Board of Health to vote no on this until we get a little bit better grip on where are we going to get staff from. If this passes, I will have to discharge 12 little ladies that have no money to pay privately. So they will need to go someplace that accepts government subsidized funding. So with that, I think we need more time to think about the ramifications of this than in implementing this in this time frame. I have some very dedicated staff that will not get the vaccine, and that leaves 2 of my homes that don't have staffing. My homes are not big enough that I can run the floor with one less staff. It's that I can either run it or I have to discharge people. So again, I'm asking you on behalf of the 12 ladies that I will discharge to please vote this no. Thank you.
Thank you. Next person I have is Karen Starr. You should be able to unmute yourself.
Hello. Hello.
Go ahead. We can hear you.
Yes, my name is Karen Starr. I own a small cafe in Callahan, Colorado. My question is, who determines what is medical or religious for exemptions? And how would the rest of us get our exemptions if this is passed?
So Karen, this is Alexandra Haas, Board Administrator, and during this time frame, we don't really answer questions. We're just taking comments and testimony.
Okay, well, I do have a comment. I am pleading with the board that they do not pass this until we have further testing and allow for the American people to make a well-thought choice for themselves.
Thank you.
Thank you. Yeah. Next person I have is initials CL. You should be unmuted. You can introduce yourself.
Hi, yes, my name is Kathleen. I'm a registered nurse. I strongly implore the committee to please, please, please mandate vaccination. I am employed by one of the largest medical insurers in the country. I do assist in the oversight of Medicare and commercial compliance. I also work to educate physicians and groups on various initiatives that assist in benefiting our patients. I do want to make it very clear that I do not in any way, fashion, or form speak for my employer. However, I am extremely thankful that my employer has mandated COVID vaccination for any position that provides direct interaction with our patient population, or furthermore, for any staff member who works in an office setting. This was done extremely fast in a very swift manner, and again, I am thrilled with this decision. Daily, I get to see COVID numbers from both across our state and across the country. This current surge that is partially fueled by the Delta variant and also a lack of vaccination is utterly frightening from both a patient care standpoint and also from a public health emergency standpoint. Now, the idea that we may lose nurses and other medical staff is very concerning, of course. However, I do want to implore the board that we will be losing many of our fellow Americans, and this includes our nurses, our medical staff, our physicians, to COVID if we choose to do nothing and not require the safe and effective COVID vaccinations. Pfizer recently did receive FDA approval, and Moderna did submit their information today for FDA approval. Those who are anti-vaccine or perhaps have hesitation toward receiving the COVID vaccine do seem to be moving the goalposts all along the course of this pandemic. First, it was the utilization of masks. Now it is vaccination. Where does it stop? The development of this vaccine was fast-tracked simply due to our manufacturers and the government cooperating with each other. Usually they don't do so simply due to financial incentives in developing medications. Thank you.
Thank you. Next, I have Madison Thompson. Sorry. Okay, you should be able to unmute.
Okay, thanks. I think I got it. My name's Madison. I'm a former case investigator and contact tracer with CDPHE, currently facing termination at my job for refusing to comply with the mandate. I also hold a Master of Public Health from the Colorado School of Public Health, and I am urging the board to vote no on this. It is very clear that this vaccine is not as safe and effective as originally thought. There are 500,000 reports to VAERS, thousands in Colorado, 82 in our state indicating mortality, and their countries recalling batches of thousands of doses of vaccines due to foreign material. I just want to know from the board if they could ensure that this would not be the case in Colorado. Is there anyone investigating the claims in VAERS? And more importantly, are you willing to put people into financial stress and unemployment when they choose their bodily autonomy, their sovereignty over compliance? Additionally, if the board wants to position themselves as solution-oriented, perhaps more time could be spent researching and recommending the treatments other doctors are using for COVID patients and focus on helping people who are already sick, instead of forcing healthy people to subject themselves to something they don't want to do. Vaccine mandates violate fundamental human rights, notably the right to prior, free, and informed consent for medical interventions. In a free society, everyone should have complete power and control over their own bodies. And I urge you to do all in your power to ensure a return to the democratic principles upon which this country was founded. Thank you.
Thank you. Next, I have Amy Bernard. Okay, I think you should be able to mute now.
Thank you, Madam President and board members, for inviting us to testify today. I am a parent of 2 fully vaccinated children that thankfully are old enough to have received both doses of the Pfizer vaccine against COVID. I am also a scientist and a PhD immunologist. I am also a member of the Colorado Immunization Advocates, and I am one of the majority of Coloradans who support the science-based public health policy. I am here to represent people in our community that are unable to become vaccinated, like young kids, people who are immunocompromised, people who are undergoing cancer therapy, the people that we need to provide for and care for. This, I would urge you to vote yes. And I support this 100%. We need to also take care of the healthcare providers that have been vaccinated and who are at the front lines, working day after day, tirelessly on behalf of everyone, knowing that the majority of the people that are in the ICU and that are dying are now unvaccinated. It's 95% and above are unvaccinated that fill up the ICUs, fill up the hospitals, and are taking so much energy from the healthcare providers that have tirelessly provided for them for the last year and a half and will continue to do so because it's their job. So healthcare providers should all be vaccinated as a first line of defense to care for their patients and for themselves and for one another. So I urge you to please vote yes. Thank you so much.
Amy? So good. Okay, so the next person I have is Pamela Greenway.
Hey guys, I just want to take a minute and say that I am 150% against this. I'm with everyone. I agree with everybody that has said that they are against forced. It's really forcing people to be vaccinated. And it's not that people are anti-vaccine. People are anti-force me. Nobody wants to be forced to inject something in their bodies. I know that CL feels that it's safe. It's interesting to me that people spout about research and science, but they only want to follow the science they agree with. So, I want you to vote against this, obviously, because I feel it's an experiment. I've been in healthcare for 30 years. And to the gentleman that spoke at the very beginning, who said that this is really not uncharted waters because we typically mandate the flu shot and people have to wear a mask during the flu season. I have worked in every environment over the course of 30 years as a therapist, never had a flu shot, and I never wore a mask or was asked to in any state that I have ever worked in. And I never got the flu. So mandating something is forcing someone. It's not law, it's forcing people to inject something they don't know what's going to happen. And what's her name? Emily talking about protecting her child with the vaccine, and the frontline workers need to be protecting her child. Yes, everyone goes to work. Nobody goes to work trying to infect someone with something. But this is an experiment, and do you care about the 13,000 deaths because of the jab? That's my question to these people that are saying they're for the shot, but they don't want to talk about the almost 14,000 deaths and hundreds of thousands of injuries caused by these vaccines. My mom was in a skilled care facility for 9 months during this crap. And I'm going to tell you, they never had a COVID case. Nothing ever happened. They wore the mask under their nose. They didn't follow any of the protocols. Anytime I had a chance to see mom or talk to her, nothing. They didn't follow them. They half did them. And nobody got COVID. No employee, no staff member, no patients in 9 months. But my mom died in 9 months because they starved her to death because we weren't allowed in. What about her, Emily? What about her protection? Nobody cares about those people. Nobody talks about that. They just want to get in everybody else's face and talk vaccine and control. This is the United States of America. My dad was in the military. I believe in the freedoms that we should have, and I'm totally against this. And I'm asking the board, take a step back. You're just a handful of human beings, but you're affecting humanity. And you need to think about that when you cast your vote.
Thank you, Pamela.
Here. This is Evelyn Borrello. Is it possible to ask that comments don't get personal? Everybody's entitled to their opinion and their experience. Nobody else should be commenting on those, please.
Okay, so next person I have is Nicole Hurley. Sorry.
Hi, can you hear me?
Yeah.
My name is Nicole Hurley. I'm a physical therapist. I'm also here with an emergency department nurse. We'll consolidate our comments for time. We're speaking on behalf of ourselves as well as outpatient occupational therapists, a home health PT, a PT in early intervention, and a PTA at a skilled nursing facility who has already quit her job due to a mandate at her facility. I want to point out that to the flu process that you all mentioned, that vaccine was developed in the 40s, not mandated in the US until the 60s. Guillain-Barré was not recognized as a complication until the 70s. So time does matter when we say that these have been sped up. Providers are people. We can also become patients. We do understand that, but we do not surrender our personhood to become an employee, and we don't need your protection or anyone else's. We take that onus on ourselves. I understand concerns that we may end up as patients, that we may take staffing or bed away from other patients, but there are ramifications on our patients if we stop working. All of us here are looking at that potential of either firing, allowing ourselves to be fired, or quitting. To the other comments and concerns and questions regarding those staffing shortages, there are hospitals here in Colorado, one of which was represented and said they had no problems, that is paying their staff $30 extra per hour to assist with lifting. It matters. So they have a high vaccination rate, but they also have a concern for their patients and their safety. I want you to understand that we've cared for people continuously and tirelessly prior to the vaccination. We wore our PPE and we've done what's been asked of us. We will continue caring for these people continuously and tirelessly until we are fired because of your mandate. Care has decreased, though, as staffing has decreased, and visitors have decreased that have helped with the staffing shortages. You've heard valid points from people here today, and you will directly impact us regardless of what you feel. An emergency department nurse cannot go work someplace else. She's an emergency department nurse. She has to work in a hospital to be an emergency department nurse. If you mandate this, you do impact my license and my ability to practice. I'm imploring you to please not mandate this vaccine, but allow our intelligence to shine through here. Like I mentioned, you've heard valid points because we have researched this and we have considered carefully what we are doing. If I put this in my body one time because it's an emergency, I don't take it out of my body when the mandate is lifted. Thank you for your time.
Thank you, Nicole. Next I have Jay Moskowitz. You should be
Thank you so much, Madam President and the board. I represent Village Senior Living and Well Age Senior Living, and we represent nursing home assisted living throughout the state of Colorado. I appreciate the board for taking consideration and passing this rule. At Village, our job is protecting the residents that we are supposed to protect in our communities and in our assisted livings. This rule will help us achieve that by making sure the residents in our communities are kept safe and the staff are kept safe. I agree with Kevin from Colorado Healthcare Association as they've done this study. This mandate will mean that people who have committed to provide care and long-term care are keeping their co-workers safe and in turn keeping the residents and guests and residents who live in our communities safe. Can I guarantee that the virus will not come in our communities? No. We know that the community rates, the virus rates in our communities are similar to the rates that we see in the communities. This is a start in the right direction to stop the spread, and by having thousands of healthcare employees throughout the state of Colorado become vaccinated, that hopefully will slow down the spread between co-workers and ultimately protect the residents that we are sworn to. Every healthcare employee in the state of Colorado has made a commitment to provide care in a safe environment to the people they care for, whether it's in the surgical center, whether it's in a hospital, whether it's a nursing home, assisted living, home health, or hospice. This helps us achieve that. I can't sit here and argue with all the people who have argued before me the outcomes, good and bad, but I know that this is proven. It's slowed down, it's saving lives. And for that, I thank the board for helping, and I thank the board for making this decision, hopefully to vote tonight and make the decision to mandate this for all healthcare employees in the state of Colorado to protect the residents and patients, our communities. Thank you so much for making this decision and moving forward, hopefully.
Thank you. Next person I have is Brad Bergford.
Good evening, Madam President and members of the board. I'm Brad Bergford, an attorney in Denver. I'm actively involved in various lawsuits, including some on COVID-19 and on behalf of businesses that have been punished for not complying with baseless, arbitrarily applied mandates that almost seem designed to destroy unfavored businesses that are deemed non-compliant. You want us to believe that you're proposing all this to protect people. We're supposed to believe that you're following the science. A study published last week by MedRx4, a Yale publication, compared natural immunity to vaccine immunity. That study notes that vaccinated individuals in Israel had 27 times, that's 2,700% times, higher risk of symptomatic COVID infection based on Pfizer and Moderna vaccines compared to those with natural immunity from prior COVID disease. We also know that the vaccinated transmit at a higher rate than the unvaccinated. This is now a pandemic primarily driven by the vaccinated, so follow the science. When you don't look to the most recent data to understand the realities that we all face, including the realities of our constitutional rights, you put us all at risk in more ways than one. And while we're on the subject, let's follow the law. You have no statutory authority to require that your subjects get the vaccine or shut down. You're perfectly willing to take the freedom of people who do not claim a religious or medical exemption, though. You're willing to say that they don't have a legal right to both work in their chosen profession and to choose their health care. You're saying that they can't have both. In a 2020 case called Ritchie versus Polis, the Colorado Supreme Court held that the Constitution cannot be suspended by the government even during a disaster emergency. The law protects the right of people to get health care at the facilities of their choice. That's been a central tenet of our society for many decades. But you're creating a system that scrutinizes facilities where medical professionals choose their own medical care as though they don't have that right, and have chosen not to expose themselves to the risks of the vaccines and or to avail themselves of exemptions. You're creating a system that has the power to punish and to refer to DORA for license revocation. Does the rule say that? No. But that's precisely the sort of activity that Colorado administrative agencies have taken so far against clients of mine. It's been complained in testimony tonight that 90% of the people in ICU, or more than 90% of the people in ICU beds, are unvaccinated. That was said as though hospitals are not designed for sick people. This is the only time that I can recall where sick are vilified for being sick. What are hospitals for? Let's remember, the hospitals love the business. They're doing well when their beds are filled. What you don't seem to understand is that Coloradans have had enough. It's been argued that this proposal is a one-size-fits-all approach where such an approach is not appropriate. I argue, however, that constitutional rights are one-size-fits-all, and they should be enforced equally to everyone.
Thank you, Brad. Next person I have is Rita Hetrick. If you're on the phone, press *6 to unmute yourself.
Can you hear me now?
Yes.
Okay, I am Rita Hetrick, and I'm the administrator for the Walsh Healthcare Center in the extreme southeast corner of Colorado. And I agree with all of these people who are saying, please do not put this mandate into place. Please hear the voices of those that are against this mandate. I have just kind of a little story. Prior to the vaccinations even coming out, we did receive COVID in our building, very small facility here. We did have 5 cases of COVID among our residents. All of them are still living with us today. They are all survivors. We had good infection control practices throughout our facility, and we contained this COVID, and this was prior to vaccination. Currently, we have a high rate of vaccinations in our facility, but it has all been a personal choice. It's not been something that has been forced down anybody's throat. We've had educational materials handed out, and these vaccines do have implications and risks and side effects that are very serious. Allergic reactions, death, myocarditis, pericarditis. These are all risks that are listed on the educational materials, and I believe people should have the right to decide whether they want to take that risk or not. It shouldn't be something that is mandated by someone who, you know, may or may not have had the vaccine. I don't know who all has taken it, but it's wrong. And currently, the unvaccinated people are being discriminated against. They have to do testing every week, while the people who are vaccinated don't. They have to. They may not be able to go into certain places because they're unvaccinated. They're being discriminated against, and this is wrong. So I just ask that you please hear the voices of all of those who are saying do not vote for this, and look at the science. Please don't take the human rights away. Our staffing is such an issue right now, and people are already walking away that are refusing to get the vaccine. So please, please vote no. Thank you for your time.
Thank you. Next person I have is Darla Siebert. You should be able to unmute.
Hi, I wanted to make mention of a couple things. First, thank you for doing this today, but I'm assuming that the governor handed you a letter, told you to research this and to make an informed decision back to him. Now, it's probably based on a very specific criteria that he wants you to already has a posed question for, but the board should go backwards like everybody's been talking about and say, what is the actual issue that is going to come of this that he's asking us? Because there are going to be a lot of repercussions. People are talking about staff issues. People are talking about human rights issues. I question whether it is a vaccine at all. They have been talking about how the fact that this is not a vaccine, it is a device. It was reauthorized for emergency use. And as Randy, your board member, was saying, people are going to constantly be changing emergency use authorizations. The fact that this has such unprecedented repercussions from taking, and you want to mandate your nurses and frontline doctors at facilities to be taking this, that's unknown, the repercussions later on. What happens if all of those at one day can't come to work? Because you mandated them, as the one nurse says, you can't take it out once it's in. So if you mandate it to them, what is going to happen if one day none of those are available to come to work? There is a court case, you can look it up on Google Scholar. It is from 2013 called Pathology versus MYRID Genetics, Inc. It was the Supreme Court that said that anybody that takes an mRNA vaccine is considered patented. You would be patenting all of your nurses. And I would recommend you look that up. So that's all I have to say. And I'm a citizen of Colorado, a concerned person that talks with a lot of people, who also has come across very many people who are now getting more and more concerned about even coming to their doctors, even going to the hospitals, even talking about whether or not they want to get the vaccine is not the issue, but they're concerned about whether or not anybody is going to be mandated this, then they're going to lose their rights and their livelihood, their jobs. And you guys are actually the front line to the defense of all of our livelihoods. So I end.
Thank you. Next person I have is Doug Farmer.
Thank you, Madam President and members of the board, for the opportunity to speak this evening. My name is Doug Farmer. I'm president of the Colorado Healthcare Association, and we represent nursing home and assisted living providers in this state. I think there's been no more severe impact than what we've seen in long-term care from the effects of this pandemic. And we know that vaccination is the most powerful tool to end the pandemic and end the isolation that so many have mentioned during testimony this evening that our residents have suffered throughout the last year and a half. We do have concerns about the impact of this mandate on our staffing, and we'll be relying on the state to support providers that need staffing support. We've spoken with the residential care strike team about this and encouraged them to use ARPA funds to support staffing services where we do lose employees because of a mandate. We support this proposal because it covers all licensed healthcare facilities. We're very much concerned that any decision to single out provider types would guarantee a shift across the care spectrum that would devastate those left under a mandate and singled out. So I will not second any of the comments that were made by other people that I agree with, but I would say that I appreciate the board's consideration of my comments. Thank you.
Thank you. Next person I have is Nicole Hurley. Sorry for mispronouncing.
It's okay. First, thank you again for allowing public comments. My name is Nicole Scavone, and I'm a registered nurse, and I'm also the president of Colorado Assisted Living Association. I would like to mirror what you just heard from Mr. Farmer, but also let you all know that we did do a poll of our membership, and the results of the poll of our members was that they're anticipating losing 15 to 20% of their staff. Now, the assisted livings that we advocate tend to be the smaller ones, a lot of Medicaid providers. So for us, the cost of wages has been incredibly difficult to compete with. It's been really challenging to continue to recruit brand new staff. So again, our concern isn't necessarily, you've heard pros and cons for mandating vaccines, but our concern very much is in regards to losing staff. And staffing shortages also are not going to be good for care. We also are very integral in speaking with the strike force and HICPUF. And our concerns are around that maybe that ARPA money might not be ready for us to use till 2022. So I just want the Board of Health to kind of take that into consideration, but our concern is really the staffing shortage. Thank you.
Thank you, Nicole. Next, I have Megan Augustine.
Thank you for having me. My name is Megan Augustine, and I'm a part of the Women of Achievement organization. I was Miss Colorado Women of Achievement in January 2021. I won Overcomers Award. We got Senate Bill 73 and Senate Bill 88 passed, and I am currently Miss Germany Women of Achievement. And my platform is Nuremberg Code, and I'm speaking on behalf of my mom, who works in a nursing home. My mom has worked in a nursing home for over 20 years, and she's already had the vaccine, but it's damaged her. It's done so much, like it's not good. Like everything I stand against this. I encourage the Board of Health to vote no. I am part German, Austrian, Hungarian, and this is just crazy. In 2011, the movie Contagion came out. I've also seen evidence of COVID tests were made in 2017 off the WITS World Bank website. I also seen Bill Gates make fun of the movie Contagion in 2015. One of my friend's dad died in the hospital. They couldn't see him. They only saw him through FaceTime before he passed away. One of my aunt's husbands passed away. She couldn't bury him at the cemetery. And none of us had COVID. None of us were sick. We were all healthy. Everybody's healthy. Everybody's fine. But I don't watch TV. I'm from the country. I'm not scared of anything. I have common sense. I'm almost 40 years old. I have common sense. If I know I can breathe, I can breathe. If I know I can taste, I can taste. So just know I am Miss Germany Woman of Achievement, and my platform is Nuremberg Code. Thank you for your time.
Thank you, Megan. Next, I have Michelle Delhay.
It won't take much time. I have a lot of similar
comments for all of those who are saying no, give this more time. I'm speaking for many of us, but especially myself as a healthcare worker for almost 30 years of experience. It's unethical to give authority to healthcare settings and then sidestep and say, but you're not in jeopardy. Your licensure is not in jeopardy. That facility will be held accountable. And while I appreciate the opportunity of the board to allow all of us to speak, you are putting us in that position should you push this forward. You're then talking about 120 days and then talking about a permanent ruling in less than that time frame. That is putting all of us at risk of putting harmful toxins in our bodies. It is not a proven and scientific vaccine that physicians who've already spoken are saying, especially if in the area of pediatrics. They have a 99.99% chance of having mild and or survivability to this. What about exactly other people have said, natural immunity? Giving 100% of a facility to say so, yet you reference the flu mandates and things of that nature, which is 90%, and many people never get the flu because they have natural immunity. It's an absolute abomination that these quote unquote vaccines are not stopped immediately. As never before in this country has a vaccine caused more injury and death than any other rollout of any other vaccine. And that's reported by VAERS. This is follow the science. You know, with this current FDA, and I feel that you are being pushed as board members. You're trying to do the best thing for everyone with the information you have. I'm wondering how convoluted that it truly is with this recent approval, so to speak, from FDA, which is a continuation of the EUA. And what was approved and being clung to is a ridiculous mandate proposal that a vaccine that has not yet been named, is not yet in production. It's based on clinical trials that omit several medical conditions, and they've also been approved to have changed that name. So please, 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 I implore you to not approve this. Give this more time. Many people, their livelihoods, your family, your friends, people will not be able to be taken care of by this because you've even all said that this vaccine doesn't prevent anyone from being able to still get it and pass it on to others. Think about what you're saying and what you're asking us to do. Thank you.
Okay, it's 6 o'clock, and at this time, we're going to turn off oral testimony. We're very, very appreciative of the public coming to this meeting. That's why we held it at this hour of the day, so that people could come, and we really appreciate your time and your efforts, and we're very glad to hear what you have to say. At this time, Dr. Costello?
Is there no, I mean, I want to make sure we get enough public comment, like, is there a way that we can allow for more public comment, but in a more efficient way? Because obviously I don't want to be here, you know, I don't think any of us want to be here all night.
Yeah, there really isn't. We announced early on that it would be over at 6 o'clock, and everyone had the possibility to send in written testimony. Again, the permanent ruling on this will be on October 21st, and we're happy to hear more testimony on October 21st.
President Hammond, just out of curiosity, are folks able to do like a thumbs up or thumbs down just to gauge who didn't get to speak?
Not at this time. I'd like to invite the department staff to return to the microphone, and if they have an opportunity to respond to any of the oral testimony.
Thank you very much, Madam President. I'm back at the mic. You know, I there are an awful lot of comments tonight, and at the end of the day, I have to say that I believe our staff has worked very hard with our experts with the best knowledge that we have before us today. We've heard from industry experts. You know, we certainly submit this emergency rule to you for your consideration, and certainly stand to answer any questions that any members might still have.
Any board members have questions for the staff? And this would be the opportunity for the staff to respond to any of the comments during oral testimony as well.
Madam President, if I might, this is Randy. I will just, I do want to respond to some of the comments with regard to our rural facilities in particular. I think our division has always had a very sensitive spot for rural communities. And I think one of the things that I want to reiterate again is that the waiver tools that we do have available to us do give us the opportunity as a department and with the best minds we have to work with facilities that may find themselves in a difficult situation. I would also bring up that our strike team group is actively working on identifying mechanisms for some additional support and help in terms of staffing. So we are absolutely committed to that, and we understand rural. Some of us have been called rural centric every once in a while, so we're going to be extremely sensitive, stay in close touch with all of these facilities, as we have done for the last year and a half. And I think we're going to learn a lot, and I think that we will find some adjustments because we want to ensure that, number one, all of our patients, clients, and residents are safe, and number two, that there is adequate access to health care across the state of Colorado.
Thank you. Any other staff that would like to comment or board have questions?
Madam Chair, if I may, there were a couple questions that I noted that I think we can speak to from the comments. The first question that I heard was a question on what the recourse is if there is a facility that is found to be non-compliant with these requirements. And the answer to that is that our normal licensure procedures would apply. So the department is limited in its actions that it can take per state law. And that ranges typically from something that we call a plan of correction, which really is our way of partnering with a facility to bring them into compliance with the regulations and provide technical assistance where we can in doing so. That would be kind of the entry level there for noncompliance. That does range all the way up to severe licensing restrictions, such as the closure of a facility through the denial or a revocation of a license. I will say that that is not a step that the department takes lightly and not a step that the department takes often. Our posture is very much more to bring facilities into compliance as we can, because as Randy mentioned, our goal is really to protect patient public health, safety, and welfare, as well as access to health care. Additionally, there are 3 facility types where finding is an option. That's our home care agencies, behavioral health entities, and assisted living residences. We are granted that permission to seek to impose a fine per statute, but only for those 3 types of our licensed facilities. The second question I heard, and I just wanted to reiterate this, I think we've talked about this, but again, was a question around who is defining or stating what is a medical or religious exemption. And again, that will be defined by the facility themselves in their policy. The department is not making that determination, nor is the department making a determination over whether an individual is granted a medical or religious exemption. That will all be done at the facility level. But those were the 2 questions that stood out to me during the public testimony.
Thank you very much for commenting on that. Any other staff comments? Questions from board members? I don't see any questions. And so at this point, I think we'd like to go around and each board member can talk about their feelings about this, and then we will do a vote. Would anybody like to venture first? The board, this is a time for the board to discuss. Mr. Alexander.
This is, as we all know, a very difficult
discussion. I take this very seriously. I've spent a lot of time thinking about my position and have reached out to a number of folks to get feedback and input. I take very seriously the fact that I represent District 4 and also represent behavioral health. And you heard some of the testimony from some folks who represent Congressional District 4. You haven't heard a whole lot about behavioral health, and I want to ask you to bear with me as I just talk about some specific issues that I think are somewhat unique to behavioral health. We have heard a lot about workforce issues. I will tell you that a large majority of my colleagues are worried about the impact of this rulemaking as it relates to the behavioral health workforce. One area that we have faced significant competition in over the last year or so as a result of COVID is the growth in telehealth competition. We have seen across the board in behavioral health, large percentage of staff leaving community behavioral health care and working and going to work for telehealth organizations, some which are national firms or national organizations. And concerns that we have, at least in the behavioral health side, that a rule such as this may force or incentivize other staff members to go to work for a telehealth organization that does not fall under the rule of CDPHE. And so I just want to acknowledge that I have some serious concerns around the rule and how it impacts particularly the workforce for behavioral health, and also how it impacts at least my constituents within Congressional District 4.
Thank you, Mr. Alexander. Any other board members like to make a comment?
This is Ray, and I really appreciate all the comments and the opinions and truly the engagement in this process. You know, as a healthcare worker myself and seeing some of the consequences of this bad disease and the differential effect on unvaccinated versus vaccinated in terms of infections and its complications. My opinion for this vaccine is positive. I think the data, although it's been quicker than most clinical trials, I've done clinical trials research for over decades, and so I think it was done carefully, and I think although it was quick, our mandate is public health and to protect the health of Coloradans, first of all, and obviously the rest of the nation. So I'm in strong support of this mandate, of this ruling. Thank you.
Thank you, Dr. Stasio. Dr. Pastua.
Thanks, President Hammond. You know, I want to thank everyone here for participating in this, and you know, the Board of Health. I think it really our role is to protect the public health of Colorado first and foremost. And you know, I as a healthcare provider myself, I took an oath, particularly to protect the most vulnerable people and vulnerable patients, and kind of that's been brought up here, the immunosuppressed and children and people that can't very well protect themselves. And I, you know, everything I know about kind of the COVID transmission, the vaccines, that with the vaccines, you're less likely to get severe disease, you're less likely to transmit. Again, it's not 100%, but it's reducing. And I think ethically, people who directly interact with very vulnerable patients have an ethical duty and a moral duty to do everything they can to try to reduce the risk of COVID transmission here. And I'm very sympathetic to all the concerns that are brought up. And I I always consider mandates a last resort in an emergency setting. But I think we're in a bad situation here and in an emergency situation here. And with this wave, it's getting worse. There are, that's kind of what I was asking. There seem to be very broad medical and religious exemptions here for it, and that it's done at the facility and not the licensing thing. And I think there's a difference in that. I think if you are working with vulnerable patients, I think there's a difference between forcing a vaccine someone and saying, hey, if you want to work with vulnerable patients, I think there's a difference. There is, like, for instance, with pilots, they require certain medical clearances for safety among the people that are in their care. And, if someone doesn't have a medical or religious exemption and they really don't want that vaccine, I think what this is saying is right now in this emergency, we can't have you taking care of our most vulnerable patients. And it's really tough. And, like I said, I heard a lot of the concerns, but I think on the balance of things, we need to do our most to protect our most vulnerable patients. While this isn't perfect and things are going through it, I do think that it seems like everyone's staff has agreed that we can change things if necessary. But I'm inclined to vote yes, because I think moral and ethically we have a duty to our most vulnerable citizens here.
Thank you, Dr. Pasquale. Mr. Butts.
Thank you, President Hammond. I guess I wanted to make probably 3 points. I greatly appreciate the community input about this. I wish we would have had time to hear more of that tonight. Secondly, I greatly appreciate the sort of uniform approach in terms of not calling out and differentiating between facilities in terms of path forward. I think the challenges in the workforce that were articulated are real challenges and are real challenges all over Colorado, but especially in our rural communities. On a little bit more of a personal note, having lost a family member to COVID in a regulated facility and having my mother's care disrupted by a home care provider who got COVID and was unvaccinated, I see firsthand the value of a vaccinated workforce to protect those at-risk members of our community. The other, I think, point that hasn't been mentioned is that we saw a lot of folks divert out of the healthcare system for fear of COVID. And every step we can take to assure that when you're having a heart attack, when you're having a stroke, that you feel comfortable going to that healthcare facility and you feel confident you'll be in a safe environment, I think that's a huge step that we should all take and support. Thank you.
Thank you, Mr. Butts. Anyone else?
Yeah, President Hammond, if I may.
Please.
And I'll try to be brief and not terribly convoluted, but I'm still working through my thoughts. So I'm probably one of the few folks on the board that does not have a medical specific background. My expertise is environmental science. I've worked in assisted living facilities. I've worked in some of these care facilities that this would impact. I've worked with some of these at-risk populations early on, more from the behavior intervention side of things. So I really do have to lean on my fellow board members that have that background that I don't necessarily have. So I can speak to it kind of from a personal standpoint. I'm like Dr. Pastula, mandates should be a last resort. I'm very pro-choice when it comes to vaccines in general. I have children. We chose early on when they were younger not to do certain vaccines, and that was our choice. The consequence was that we then did not use daycare facilities. We didn't enroll them in preschool. So that was a consequence of our choice to not do those vaccines because we did not want to spread those diseases. We did not want our kids to be infected. That's what we had to do. And so I see it kind of like Dr. Pastula said, you know, if you want to work with these vulnerable populations, this is a choice. It's still a choice. You choose to not vaccinate for this disease that's preventable or can be lessened by this vaccine, then you can't work with these populations. You can work with other populations. You can do other things. This is not the time. And so that's kind of where I have to come from it. You know, I have to rely on the expertise of the other folks on this board. It's not an easy decision. I appreciate everybody coming out. I read all 650 pages of the public comment. I listened to everything tonight. I wish we had time for more. We will if this moves forward and there's another hearing, and I look forward to those additional comments. But we are in a bad spot. And there are consequences to our choices, and we just, I don't know what else to say about it. I know it's not an easy decision, and I want everybody that's on here to understand that we don't come by this lightly. And that's all I have.
Thank you very much.
Madam Chair, if I may say.
Please.
And I don't want to be repetitive with what, you know, other board members have said, but I would say that I echo everything that everyone has said. I completely understand the implications that it will have in the shortage of healthcare workers. And that is very unfortunate because we need them more than ever before. But I am reminded by my board member, by my fellow board members, that my duty here is to protect the health of Coloradans, particularly the most vulnerable, and to represent the people of Colorado. And, you know, some voices are sometimes stronger than others. And there are many voices who have not been represented today. The people who are suffering, the people who are vulnerable, the people who can be there to say, I wish I would have been protected. I wish others in my community would have been protected. In particular, the ones that cannot be vaccinated. I'm not talking about the choices that people make, but the people who have no choice and getting this terrible disease. I'm thinking about the most vulnerable. So I am in support of this rule, primarily trying to put my hat of what I was asked to do and represent, and I'm trying to think of those who are most vulnerable. And that's why I am in support of this rule.
Thank you very much. So I also will try not to be repetitive, but as a retired RN who worked in emergency rooms and trained EMTs and worked in home care and hospice for many, many years, I have to go along with Dr. Pastul and Dr. Stasio and Dr. Barreo that we not only is our mandate to protect the health of people in Colorado, but our mandate is also to follow the evidence of science. And I am quite disturbed about the new variant that's just coming out from South Africa. And I think we're going to see more and more and more problems with this virus. And if the more we can get things under control now, the better off we'll be. I'm also very concerned with the amount of misinformation, and I appreciate everybody that came this afternoon and spoke, but I would just ask everybody to be really careful about the information that you believe. And so I am definitely in favor of this. I also have huge reservations about mandates. I have huge concerns about staffing problems, but I think this is a direction that we absolutely need to go in. And so at this point, I would ask for someone to make a motion regarding this emergency rule. Dr. Stasio.
To get this right, I move to adopt the proposed emergency ruling on CCR 1011-1, Chapter 2, General License Standards and the COVID-19 vaccine. The board finds that immediate adoption of this rule is imperatively necessary to comply with a state or federal law, or federal regulation, or for the preservation of public health, safety, or welfare, in compliance with the notice provisions of Section 24-4-103 of the State Administrative Procedure Act, would be contrary to public interest.
Thank you, sir. And Dr. Brea would make a second. So the motion has been made by Dr. Stasio and second by Dr. Barreo. And I'm sorry, but the motion is way too long for me to repeat, but I think you all heard it. And so I will ask for all those in favor, please say aye.
Aye.
Aye. Those opposed, same sign.
Aye.
So we're 6, 4, and 1 against, and the motion passes. And I thank you all so much for your attention and being here this evening. And again, a big thank you to all of the public that came, where we read pages and pages of your written testimony, and we appreciate the time and effort you put into that. And we appreciate your enthusiasm and the time and effort you put into being here this afternoon. We'll see you all October 21st for our permanent ruling. And meanwhile, bear in mind that our staff is totally on top of this, and as changes need to be made, they will be. Thank you all very much. Meeting adjourned at 6:23.
Thank you.
Thank you.
The recording has stopped.